everyone, and thank you so much for joining the NeedyMeds special topic webinar, Connecting Underinsured Patients with the Treatment They Need, presented by the PAN Foundation. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. And before we kick off today's presentation, I just wanted to offer a few tips so you can make the most out of it. So first of all, if you do have any questions, you can feel free to type them in at any time into the questions section of your GoToWebinar control panel. Just know we will reserve answering questions until the end. If we don't get the chance to answer your question, we will follow up with you personally via email. But of course, you can always reach out to the PAN Foundation and NeedyMeds directly, and that contact information will follow at the end of the presentation. Also, I wanted to give you the heads up that this presentation is being recorded and will be available on the NeedyMeds YouTube channel. And if you are interested in checking out the PowerPoint slide decks that accompany today's presentation, you can find them in the handout section of that same GoToWebinar control panel. So with that, let's get started with what is NeedyMeds. What you're looking at on our screen is all of our formal wording about our mission statement, our vision statement, and a statement about how we achieve our mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through a website and toll-free helpline. And I'm just going to take a break to check in because I am working from home like so many people, and I want to make sure that you guys are still hearing me clearly. So if you wouldn't mind sending me again a message in that question section of your GoToWebinar control panel, that would be helpful. Thanks so much. So getting back to what NeedyMeds does, oh good, I'm coming in loud and clear, fantastic. So NeedyMeds, again, we connect people to programs that will help them afford their healthcare expenses. And we do that again free and anonymously through a website, needymeds.org, and our helpline, 1-800-503-6897. And I always really like to put up a screenshot of our homepage because our website is really the face of our organization. And it gives me an opportunity just to point out a few resources I think you would be interested in. First of all, if you are interested in finding healthcare cost savings resources, you can begin by checking out that patient savings tab. I'll also encourage you to check out the advocates tab. And that's a great tab because that's where you can find other upcoming webinars. You can sign up for our monthly webinar announcements or a monthly newsletter or order brochures. I also want to point out on the top right-hand side with the rest of the social media icons, it's the third one from the left, is the link to our YouTube channel. I'm mentioning that because, as I said, this webinar is being recorded and will be converted into a video to be posted on that YouTube channel. We encourage you to subscribe. That way you won't ever miss out on any new presentations, webinars, or videos. And you can also find other upcoming webinars on the bottom right hand of our homepage under calendar of events. So as you saw in our mission statement, a big part of what we do is education. And we define education really in two ways: by educating people about NeedyMeds and the resources we have to offer, by also educating our users about other resources that will help them get connected with the resources they need, which is why we are so pleased to have Audrey and Joan from the PAN Foundation with us today. So first, let me tell you a little bit about the PAN Foundation. The PAN Foundation helps underinsured people with life-threatening, chronic, and rare diseases get the medication and treatment they need by paying for their out-of-pocket costs and advocating for improved access and affordability. Now, let me tell you a little bit about our guests, Audrey Quadri and Joan Zhang. Audrey is the Senior Manager of Provider Relations and helps to develop and implement PAN's provider outreach strategy. She has 10 years of experience in the healthcare industry, focusing on insurance coverage, reimbursement, and access to care. She holds a Bachelor of Science degree in Business Marketing from Syracuse University. Joan is the Manager of Medical Affairs at PAN and reviews the clinical parameters of PAN's assistance programs and conducts outreach to pharmacies and related professional groups. She's a licensed pharmacist with a Doctor of Pharmacy degree from Shenandoah University, Bernard J. Dunn School of Pharmacy. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Joan. So bear with us while we do that. And as I'm transferring the screen to Joan, I will remind everybody that, again, if you do have questions, you can go ahead and type them into that questions panel of your GoToWebinar control panel. And with that, I'll pass the mic to Joan and enjoy today's presentation. Thanks, everyone.
Hello, everyone, and thank you for taking the time today, amidst everything that's going on with COVID-19, to join us and learn more about the Patient Access Network Foundation, or PAN for short. My name is Joan Zhang. I am the Manager of Medical Affairs at PAN, and today I'm joined by my colleague, Audrey Corte, our Senior Manager of Provider Relations. Today, we'll walk you through what we do, why we do it, and how you can apply and receive assistance with PAN. We know that we are going to provide you with a lot of information today, and that you may not be able to absorb all of it. So we encourage you to send us your questions. And as Carla said earlier, this webinar will be recorded and the video will be available for your review at a later date. First, let's get started with why copay assistance is important. As you may already know, access to medically necessary treatment is critical for successful patient outcomes. However, this access is often blocked by high cost sharing, which can negatively impact both quality of life and the course of a disease. High cost sharing refers to healthcare expenses that are not covered by an individual's insurance plan and must be paid out of pocket by the patient. These out-of-pocket costs come in the form of deductibles, copays, and coinsurance. Patients who have insurance but are unable to afford the out-of-pocket costs associated with their treatments are considered underinsured. Between 25 and 30 million people were underinsured in the United States as of 2019, with an estimated 16 million people reporting job losses in the past 3 months alone due to COVID-19. The current underinsured population is sure to grow larger this year, creating an even bigger gap in the underinsured population. In the past 3 years, an estimated 4.1 million people spent more than 10% of their income on high out-of-pocket costs. For many patients with chronic, rare, or life-threatening diseases, this cost of care can add up quickly, putting many patients in the underinsured population. In 2019, Chagall Research conducted a survey to assess patient satisfaction and the perception of services provided at PAN among the patients receiving financial assistance. Prior to receiving PAN assistance, an estimated 51% of patients skipped taking their medication or took smaller doses. After receiving financial assistance from PAN, this number dropped significantly to only 9%, which shows the need for more financial assistance to support the underinsured population. Furthermore, limited access to prescription medications excludes financially vulnerable patients from the benefits of specialty, high-cost, medically necessary prescription medications. Advancements in new therapies could also mean even higher prescription cost sharing, and this increasing burden will once again fall directly on the patient. In the same study conducted by Shugal Research, many patients faced high out-of-pocket costs, and as a result, as many as 94% reported that the support from PAN made it more likely for them to take their medications as prescribed, and had a positive impact on their family. While 92% reported that support from PAN has improved their quality of life and decreased stress levels for the whole family. Finally, 86% also reported that support from PAN has increased their ability to pay other medical bills. The Patient Access Network Foundation believes that out-of-pocket costs should not prevent anyone from obtaining medically necessary treatment. And so today, we are going to tell you how PAN can help remove the financial barriers and alleviate high out-of-pocket costs for the underinsured. So with that, I'll turn it over to Audrey, who will tell you more.
Thank you, Joan. Let me begin by telling you who we are and how you can apply for assistance with PAN. The PAN Foundation is a nonprofit organization dedicated to helping federally and commercially insured patients by helping them pay their out-of-pocket expenses for their prescribed medications. Since its founding in 2004, PAN has provided nearly 1 million underinsured patients with over $3 billion in financial assistance. We have 3 types of assistance programs. First, we have medication assistance programs, which includes assistance for deductibles, co-pays, and coinsurance. Then we have premium assistance programs, which assist the patient to pay their premium insurance. And lastly, we have travel assistance programs, which helps to cover the cost of approved transportation, lodging, and other travel expenses incurred from the patient's treatment visits. All our programs are provided in the form of financial grants. PAN provides financial assistance for over 70 disease funds ranging from chronic, rare, and oncology diseases. We recently added sickle cell to our list of disease funds and launched the COVID-19 Treatment and Prevention Assistance Fund to support those affected by these uncertain times. The COVID-19 Disease Fund is unlike any of our other assistance programs in that it covers a range of services, including over-the-counter and prescription medications, medical supplies and equipment, and transportation to medical or pharmacy appointments, as well as groceries and meals. To see a full listing and current statuses for our programs, please visit our website at panfoundation.org. A common question we receive at PAN is what we cover and do not cover. So at PAN, we cover products that are FDA approved or listed in official compendia or evidence-based guidelines for the specific disease fund. This includes all prescription medications in each disease fund formulary, such as brand and generic medications, bioequivalent or biosimilar medications, specialty drugs, and radiopharmaceuticals. Very few disease funds also cover medical supplies for administering treatments. An example of this is our Parkinson's Disease Fund. Now that you know what PAN covers, it is also important to highlight what PAN does not cover, as we often receive requests for payments for products or services that we do not cover. This includes any medication which is covered at 100% by the patient's insurance. We also do not cover any medication which the patient's insurance does not cover, as well as any medication not on our disease fund formulary. However, an exception to this rule is if a medication is indicated or guideline recommended for a disease state, but is not listed on our formulary. In this instance, you may submit a request on our website or call us to add the drug to our formulary. Finally, we do not cover medical services such as doctor's visit, lab work, genetic testing, ER or hospital visits, diagnostic testing, etc. So our grants provide 100% assistance for most of our patients. And we look at the historic data as well as industry trends to determine how much a patient is going to need for a specific disease fund and allocate a certain dollar amount to that fund. In instances where the patient needs additional assistance because the out-of-pocket cost is higher than the average, we offer second grants to cover the remainder of the enrollment period. What this means for you is that if the disease fund is open at PAN and the patient runs out of funding before their enrollment period ends, you can apply for a second grant to cover the remainder of the eligibility period. In addition, we review all assistance amounts annually to ensure that patients are receiving adequate financial support throughout the year. So don't be surprised if the amount that we offer for assistance change from year to year. So it's always important to check our website to verify this information. The next few slides will focus on how to apply for assistance with PAN. There are 4 easy steps to keep in mind when applying for assistance with PAN. First, we want you to check to see if the disease fund that you're interested in is open. Second, please verify if the patient meets our eligibility criteria. Third, gather all the required information. And fourth, contact PAN to apply. So we'll take each checklist and then review it in depth in the next few slides. Step 1, check to see if the disease fund is open. There are 3 ways to do this. You can go on the PAN website at panfoundation.org and type in the name of the disease fund. As shown in our example on the slide, if the program is open, the status will indicate open next to the disease fund name, and the same for if the disease fund is closed, you will see the closed status indicated next to the disease fund name. Another way to verify if a disease fund is open is also by visiting one of our portals. So we have patient, provider, or pharmacy portal, and you can verify if the disease fund is open on the Disease Fund and Medications tab. Finally, you can call PAN to verify the current status of all our disease funds. Step 2, verify if you meet the eligibility criteria for the disease fund in which you're applying for assistance. The following are our eligibility guidelines for all our disease funds. 1, the patient must be getting treatment for the disease fund in which he or she is applying. This means that if you're applying for assistance with our asthma disease fund, the patient must be diagnosed with asthma, and the medication you're seeking assistance with must be covered under our asthma fund formulary. 2, the patient must have health insurance that covers his or her qualifying medication or product. 3, the patient's medication or product must be listed on PAN's list of covered medications. 4, the patient's income must fall at or below the federal poverty guidelines specified by the assistance program. So it is important to note that the insurance and income criteria vary from each program, so be sure to verify this and all of the program guidelines on the specific disease fund page on our website. Finally, the patient must live and receive treatment in the United States or U.S. territories, although U.S. citizenship is not a requirement. Example of an assistance program. So most of the information that you will need to verify on the previous slide can be found on the Specific Disease Fund page on the PAN website, which can be accessed at www.panfoundation.org. This slide is an example of the Disease Fund page on our website. Here, you can verify the assistance amount allocated to the fund, the eligibility criteria, and if your medication is on our formulary, and if the diagnosis code is covered. Step 3, gather all required information. If the patient meets all the criteria listed on the previous slide, you will need to gather the following information before you start the application process. You will need the patient's demographic information, such as the name, address, phone number, and email address, although the email address is optional. You will also need the diagnosis and medication name, as well as the patient's health insurance information, the income, and the number of people in the patient's household. Finally, you will need the physician and facility's contact information. Now you are ready to apply for assistance with PAN. There are two main ways to do this. You can either give us a call Monday through Friday from 9 a.m. to 7 p.m. Eastern Time at 866-316-7263, or you can log on to one of our self-service portals listed here. As you can see, each portal is designed with the end user group in mind. The provider portal serves our healthcare providers, whereas our pharmacy portal is intended to serve our pharmacy personnel. And most importantly, our patient portal is designed to serve our patients and patient caregivers. On average, it takes about 7 minutes to complete an application with PAN, and our enrollment decision is immediately after. We'll provide you with the enrollment details and processing information right away, and then follow up with an email or fax to the physician's office. We will also ensure that the enrollment details and processing information is emailed or mailed to the patient as well. What to know about the PAN grant? Now that the patient is enrolled, there are a few things to consider about the PAN grant. Each PAN grant eligibility period is for 12 months. However, if the patient enrolls for the first time in any of our disease funds, we will help them cover any claims incurred in the past 90 days before the enrollment start date. In addition, claims must be submitted every 120 days in order to keep the grant open throughout the eligibility period. This is considered our grant use policy. You may also apply for a renewal grant as early as 1 month before the end of the eligibility period. We provide 3 ways to submit expenses to PAN. And it is also important to note that once the grant is approved, that you may begin to submit claims to PAN immediately. We want the reimbursement process to be simple and quick for you, so we provide several ways for you to submit your claims. So the first way is if the patient receives their medication from a pharmacy, the pharmacy can bill PAN either electronically or submit a claim via fax or mail. The second way is that if the patient receives their medication from the doctor's office, the doctor can bill PAN electronically by fax or upload a claim on our provider portal. The third and final way to submit claims to PAN is that if the patient prefers to bill us directly, the patient can submit the prescription label or remittance advice for services rendered at the pharmacy or an explanation of benefits for services rendered at the doctor's office, along with a completed direct member reimbursement form. Additional information on filing claims can be found on our website at panfoundation.org under Get Help. We'll also make sure to communicate with you every step of the way until you receive your payments. So we are PAN, we are committed to providing holistic support to our patients. We know that managing an illness is difficult, and our patients who apply for assistance with PAN may need additional support beyond financial assistance. They may also have questions about their disease and treatment, side effects, and medication adherence. And they may also benefit from connecting with a compassionate community that can help patients deal with the physical and emotional complexities of their disease. That is why we have formed alliances with leading patient advocacy groups such as the American Liver Foundation and the Parkinson's Foundation, to name a few, to provide patients with the holistic support that they need. When a patient or caregiver applies at PAN, they're given an option to opt into receiving communications from a respective alliance partner. If the patient opts in, our alliance partner will reach out to them directly and provide them with more information. I am really excited that I had this opportunity to tell you about our programs, and I hope that you enroll with PAN to benefit from the many assistance that we have available for patients. And now I'll turn it back over to Joan.
Thank you, Audrey. We want to encourage you to stay connected with us once you enroll with PAN. We understand that you have a busy schedule, and because of that, we've made our processes quick and simple for you to stay connected. We provide many resources to help you along the way. One way to stay connected with PAN is through our website. We have redesigned our website to make it easier for you to find the help that you need. By navigating the top menu bar, you can quickly get help, find a disease fund, or explore our many resources available. For instance, on the Get Help page, you can find frequently asked questions specific to patients, providers, or pharmacies, as well as find information on how to apply for assistance, manage your grants, and file a claim. On the Explore Resources page, we have short webinars about our programs, as well as our provider and pharmacy billing guides, and additional resources under the Advocacy Resources page. And as we mentioned earlier, on the Find a Disease Fund page, you will find a list of our assistance programs, the fund eligibility criteria, and fund formularies. We will also provide you with referral information to other foundations if the disease fund you are looking for is closed at PAN. You may also sign up for our new disease fund waitlist, which is a list of patients waiting to apply for assistance from a closed disease fund. The waitlist enhances our abilities to serve patients on a first-come, first-served basis by giving those on the waitlist the first opportunities to apply for assistance when a fund opens. People on the disease fund waitlist will be notified via email when the fund opens in waitlist status. and they can apply before the general public. You can sign up for our Disease Fund waitlist on our website, by calling us, or on the portals, which we will discuss next. First, we have our patient portal, where a patient can apply to PAN by simply going to panapply.org to complete a short application. Once enrolled, a patient or caregiver can manage their account, review their eligibility period and grant balance, sign up for a second grant if they are out of funds, renew their grant starting from 1 month before the end of the eligibility period, and review correspondence letters regarding their account. All of this can be done without picking up the phone. If you are a provider or pharmacy, you may also apply on behalf of your patients at providerportal.panfoundation.org or pharmacyportal.panfoundation.org. Here, you can utilize the same features as on the patient portal with some additional features such as communicate with our portal support team via secure messaging, access all PAN correspondence letters regarding patient accounts, manage your facility accounts, view process claims, and run reports. For our providers, you may also upload and submit claims on the provider portal. Finally, announcements and updates are displayed on both pharmacy and provider portal login pages. PAN has also created a free web-based app called FundFinder. This first-of-its-kind app helps all audiences track the disease fund statuses across all of the 9 charitable copay assistance foundations. You can simply go to fundfinder.panfoundation.org, or you can find the link on our website. Once you sign up, you may follow any disease fund and receive notification alerts via email or text message when the specific fund opens at any of the foundations. FundFinder helps you save time by not having to frequently check multiple websites. Our goal is to help you find the support and resources you need so you can spend less time on the manual work. Finally, we know that the PAN Foundation is one of many resources to help patients, and we encourage you to reach out to us. By doing so, we can listen to your needs and understand how we can help. Now I will switch it back over to Audrey.
Thank you so much, Joan. And thank you all so much for joining us today. You can reach me directly at 202-370-4824 as indicated on this slide, or you can email me at acorte@panfoundation.org. Also, if you would like to sign up today, please contact us at our call center at 866-316-7263, Monday through Friday from 9 a.m. to 7 p.m. Eastern Time. Or you may apply online at panfoundation.org. We look forward to working with you soon, and thank you so much for your time today, and we hope that you are staying safe during these uncertain times. And I'll go ahead and turn it back over to Carla, who will lead our question and answer section.
Audrey and Joan, thank you so much for another great presentation. And to our audience members, the reason I say another is because we bug Audrey and Joan to come back regularly to share their expertise about the PAN Foundation with the NeedyMeds audience, because it is just such a fantastic resource. I was impressed with the statistics they shared in the beginning of the webinar, and I had several audience members already message me saying that they were impressed that the PAN Foundation already is offering support for COVID-19 related issues. That's one of the things that one of the reasons we're so proud to partner with the PAN Foundation, because their information is accurate, up to date, and current. But beyond that, they really go out of their way to make it clear what they do, how to do it, how they do it, and how you can enroll, as evidenced by the process being simple, them extending business hours from 9 to 7 in the evening, and making the application process simple. As they said, the average application only takes about 7 minutes, and you get an immediate response within about a minute as to whether or not you're able to enroll. So I can't say enough good things about the PAN Foundation, and I do hope that you visit our YouTube channel on NeedyMeds so that you can scoop up a copy of this presentation and share it to your patients, your family members, your loved ones, and your neighbors, because it's really a great resource. Before we get to those questions, a couple of things I do want to remind everybody about, and one is that we pride ourselves here at NeedyMeds also being a source of support for you. So if you are looking for additional healthcare cost savings programs, please check out the NeedyMeds website. And as I said in the beginning of the presentation, you'll begin your search under that patient savings tab, or you can reach out to our call center counselors. And we do have Spanish-speaking counselors as well. So please do check that out. As promised, we are going to get to the questions now, and there are a bunch that came in. And I did want to leave up that contact information so that you can jot down any numbers or information you'd like to hang on to. And a reminder that you can find copies of my PowerPoint presentation, and more importantly, Audrey and Joan's PowerPoint presentation, in that handout section of your GoToWebinar control panel. So with that, I do want to get to some of the questions that are coming in. And a reminder that if you did ask a question and we won't get the chance to answer it, we will follow up with you via email, or you can always reach out to NeedyMeds or the PAN Foundation directly. So one of the questions coming in, it's a great question, you guys probably get it all the time, which is, can I download the Find Funder app on my phone?
Thanks, Carla. This is a very common question we have. So currently, Fund Finder is not available on any of the app stores. Since it's a web-based app, as of right now, you can only access it on your internet browser. But with that being said, you can still access Fund Finder on your phone if you open your internet browser and go to www.fundfinder.panfoundation.org.
That's very helpful. And I always am glad when our audience members speak up and ask a question, because I say this almost every webinar, that if it's something one person is thinking, probably other people are thinking it as well. Another great question, which I bet is also a common one, is does PAN require a 1040 income tax document with the application, or something to prove income?
That's a good question. I can go ahead and answer that one. This is Audrey. So initially, when you apply with PAN, we don't require any documentation. We just ask that you provide it verbally if you called us to apply, or if you went online, you just report what your income is. And as you were explaining earlier, and as also we talked about on the presentation, the application process takes about 7 minutes, and right after you're done, we're able to provide you with a determination right away. So you know right away if you've been approved or denied. What we'll do, though, in the background is that we do check with the reported income against what is reported on Experian. So if you find that there's any discrepancies between the two, then we will follow up with you to request income documentation. And so then you can submit your tax information. But we don't typically require it, not unless we find that discrepancy. That's when we'll follow up with you.
Great. Thank you so much for the thorough response and for the question. Another question coming in, actually, I got this question a few times written a different way and citing different medications as examples. But basically what people want to know is, what can I do if my medication is not covered by PAN? And we have some people writing in about specific medications such as Xarelto that they're looking to find a program on. What does somebody do if their medication isn't covered?
Oh, okay. That's also a good question. If your medication is not covered, on our website under the medications covered tab, or also like find a disease fund tab, actually there's an opportunity there for you to put in your information and send us a message if you don't see your medication listed. So this is just something you go on panfoundation.org and then go to find a disease fund. And once you get on that page, there is a box to your right-hand side where you can send us a message if you don't see your disease fund that is listed. You can also give us a call and let us know about it, and you can submit your request that way. The only thing with this particular question is that we always like to let people know we usually have to review on the back end just to make sure that this is a medication that should be covered under a specific disease fund. So please allow for maybe about 7 business days or so for us to get back to you as we are reviewing and doing our research.
So helpful. And that's another thing that we always really respect about the PAN Foundation is the transparency of how they go about approving medications and what the time frame will be. That's really appreciated. So we're going to wrap it up with one more question because we do try to keep the question segment brief. But again, if you did ask a question we didn't have the chance to answer, you can reach out to the PAN Foundation or NeedyMeds, or we will follow up with you via email. So the last question I'm going to ask you, Audrey or Joan, and this is another good one, which is, how do I check to make sure my meds will be covered before I apply to PAN?
That's a perfect question to start with, to end with the last question that we had. So you can actually find our formulary on our website at panfoundation.org and refer to the specific disease fund programs for the medication covered. So like Audrey said, under the Find a Disease Fund tab, you'll find all of the disease funds. And within each of those pages for the specific assistance program, you'll have a list of the formulary right there on the website.
So helpful. So thanks everybody so much for taking the time to join us for today's presentation. And a big thank you to Audrey and Joan for giving such a thorough and easy to understand presentation. I also want to take just a quick moment to let everybody know that since it came up earlier in the presentation that the PAN Foundation does have COVID-related assistance available, that NeedyMeds also is working to unveil a COVID-19 resource center. It'll be hopefully a one-stop to help you meet your any financial hardships that you are experiencing or help you to afford healthcare-related costs that you can't meet because of this pandemic. So please check out our NeedyMeds website. Again, that's needymeds.org, and you will read about it right on our homepage, and we hope to unveil that shortly. And if you're aware of COVID-related assistance programs that you don't see posted, please get in touch with us. You could shoot me an email at carla@needymeds.org. So with that, I want to thank everybody again for taking the time to join us and participating so much in today's presentation. And I thank you again to Audrey and Joan for sharing their expertise with the NeedyMeds audience. Everybody have a good rest of the day and stay safe. Thank you.
Thank you so much for having us. Stay safe,
Thank
everyone.
you.